Can you hear me okay? Okay, great. I think we're going to go ahead and get started on our next panel. So our next panel will be provider panel. We have 3 speakers who work in the community for organizations committed to providing health, mental health, advocacy, and more to immigrants in Michiana. They will describe the organizations, their roles, and what they see as priorities to address the mental health concerns in immigrant populations. My name is Raegan Minear. I'm a social worker at Adams High School. I'm also a clinician with Samaritan Counseling Center, so I'll be the moderator today. I'm going to read through their bios, and then I will have them come up, explain about the organization, their role, and what they see as priority. First is Mayra García, is a community health worker at Heart City Health Center. As a community health worker, Mayra connects patients and individuals in our community to resources, as well as creates avenues for collaboration with community partners. Originally from Honduras, Mayra immigrated to the United States in 2006 and has been living in Michiana area for the past 10 years. Mayra has worked primarily with nonprofit organizations to better the lives of the most vulnerable populations and has been serving Elkhart County since 2019. Mayra is currently pursuing her bachelor's degree in business administration and is a mother of 2. Mayra volunteers her time with different organizations to provide marginalized community access to resource and opportunities. Next up is Jona Vitela. She is a behavioral health therapist at Maple City Healthcare Center. Originally from Denver, Colorado, she has lived in Indiana since 1995. Jona identifies as Mexican American, Chicana. Jona holds an MSW degree from Indiana University with a license as a clinical mental health therapist and a licensed clinical addictions counselor. Next is Dara Márquez, is a director of community engagement at La Casa de Amistad in South Bend. As an executive leader for the organization, Dara manages social service staff and leads advocacy and community engagement efforts. Originally from Apan, Hidalgo, and Mexico, she has lived in the U.S. since the mid-1990s, since immigrating to Elkhart with her family. Dara graduated from St. Mary's College with her BS in chemistry and Purdue University with her MS in chemical engineering and attended school as a DACA student. Dara's career shifted from chemical engineering after experiencing a renewed vision of social services for immigrants, especially after many undocumented immigrants experienced loss and underrepresentation during the pandemic. She joins us in her role with La Casa de Amistad as a volunteer community organizer throughout the state of Indiana for immigration rights. So I'll have them come up and talk more. Mayra, you first.
Hi, everyone. Thank you so much for being here. Buenos días a todos. Quiero primero decir thank you. I want to first say thank you to Anham for putting this together and the NH, and I'm sorry if I say it wrong, Northern Hispanic Health Coalition. I apologize for that. It's a long acronym. As I was mentioned before, I work with Heart City Health. Heart City Health is, our main mission is to provide quality health care for our community. And what we have been doing for the Hispanic or immigrant community really speaks to our mission and our heart to really provide individuals with the best health care. Recently, we have been focusing on helping the immigrant population by bringing in awareness. Our behavioral health department is really driven by being culturally competent for our families, not only making sure that our staff is well trained to understand the problems that immigrants are facing on their journey here, but also what it means to kind of integrate into our community. We are working very hard on being out into the community, being seen, and being letting our community and our culture know that they are here. We have an array of bilingual staff to make sure that we can take care of their needs at every point. As part of the outreach department, I help individuals find resources, and mental health is one of those resources that we are seeing that is very hard to get to, whether it be because of a stigma, already coming in with that fear of not knowing where to get help and then even how to get the help. A lot of the gaps that we're seeing is that individuals don't have health care. So they arrive, maybe they can qualify for emergency health care, but that doesn't cover mental health. And then how do we help? How is Heart City Health, how do we help them find providers or individuals that can help them with this? So in my role and in our team's role, what we do is find those resources, whether it be with Heart City Health providers or whether it be with other agencies who can provide them this care. Heart City Health meets each individual where they're at, whether they have health insurance or not. We try to help them meet those gaps. We also know that transportation for our people is a huge barrier. So we do everything that we can to make sure that individuals are, getting to their appointments once we find them a provider. We also want to make sure that they're, culturally appropriate and competent. To Liliana's point, just because we're all Hispanic doesn't mean that all of our, nationalities have the same concepts. Being from Honduras, that has its own set of barriers, just as well as individuals that come from Mexico or individuals that come from Chile. Our staff is well trained to understand the different nuances from each nationality. And they're also well trained in how to handle that family, the family dynamics. Hispanic communities and families are well knit, and to the point of some of the individuals being born here, the youth being born here, and the parents being born in other countries, those different cultures are there. So our staff is well trained to understand the differences in those cultures and in the families. We are also very well trained in understanding that the opportunities for people once they get here is very hard, because you'll have individuals and families arriving, say, last week, and while everybody is making sure that they have the money to pay for their bills, the transportation, and so on, mental health kind of gets put in the back burner. But as a community health worker, it is my job to make sure that the family has all those immediate needs, but also sees mental health as an important need that they need to take care of right away. Our City Health is also working with other community partners to create those partnerships that allow us to talk to families and individuals and say, hey, I know someone in this agency who would love to talk to you about your journey, help you with any struggles and barriers that you're facing. Let me give you their phone number. It is very hard for individuals who are just arriving in the country to find their community. They're often felt isolated. So it is our job as a community health worker, and Heart City Health has taken it upon themselves as well to find communities for these individuals, whether it's connecting them with a local church that can service them in their religious needs, or whether it be other agencies that we can contact and say, hey, do you have anything for this individual? Can we do something for them and their immediate needs? And that's how we're helping the immigrant population adapt and grow and excel in our community. I want to say thank you to everybody for being here, for taking the opportunity to see this, see the need that is needed, and also be willing to be part of the change. So thank you so much.
My name is Jona Vitela, and I say it that way because I don't want to say it the English version. So I started at Maple City Healthcare Center a few years ago. But before that, I came to this area in 1995, and I would not have witnessed this years ago. This just brings a lot of hope to our families, our community, and to know that you're not walking the walk alone any longer, that you're not the one that has to be the provider, the interpreter, the translator, the case manager, the skills trainer, transportation, food resource by yourself any longer. It led us to doing some great things, but now we're in this together, and I'm no longer doing the work alone. And going to Maple City, they gave me everything I needed so I can continue to do great work. I have every single support that I need in place to address what we're seeing in our families, in our communities. April's the month of suicide. Guess what? It started early in March. And I'm on my feet. I no longer wear high heels. I wear tennies everywhere I go. You call me in, crisis doctor calls me in. I'm looking at you for mental health addictions. I'm looking at the whole person. The provider came to me and said, Jona, I want you to meet this person, warm handoff. Went in, opioid. I said, do you know about Narcan? Gave him some medication. 2 days later, he's asking for me. Comes up, says, I need to talk to her. They said she's busy. I need to talk to her. I come out, he says Narcan. I said, I got you. Ran back, got the Narcan, trusted him enough to follow him out to the parking lot and save his friend's life that was dead in the parking lot. I had already talked about restarting the addictions group in Spanish to meet the needs of the language and our culture, because we didn't have it. We had to have interpreters, and we had to have all these barriers in place that we could not knock down. And so years before that, I had started my journey, but again, carrying it alone was too heavy. It's too hard. People say, be careful of burnout. I was. Took some time. But once I had everything I needed, I said, it's time to hit the road. It's time to get out there in the field, walk with the people, be on the ground, not send them out to a resource, ensure they get that resource. They meet that person, that face, that name, and be there with them, but seek to understand. Every single person is individual. Every family is individual. And I said, how do I get to the top of that waterfall? Because I don't want to be at the bottom anymore. I need to start saving things and changing things. Well, my choice wasn't to go into addiction. Somebody chose me at one point when we were in school. Raegan was with me. And I said, all right, I'm going to take on this. I'm going to go into addictions because I don't know about it. It's scary. I want scary. Give me scary. But it wasn't scary. They were children with trauma. That's what it was. And I thought, I could do this work. Big numbers, give me big numbers, because then I can make a huge impact in my community. And when I say my community, I mean everything. Elkhart County, St. Joe County, we have coming from LaGrange County to an addictions group that I just restarted. And because of Maple City growing and giving us what we need, we're on our third site now. This third site met the need of transportation and space. We treat the addiction at this group at no cost. You're not gonna find that anywhere else. I'm willing to see them where they're at. You know what, zero tolerance, I gotta treat you where you're at, because if I'm gonna save people, if I'm gonna treat the family, if I'm gonna be on the ground, I'm gonna be where you're at. Individual sessions for therapy comes with that. They get to see the psychiatrist, we have 2 now. They get to do medical care, see a nutritionist. We have everything there. Somebody says, you're like a Walmart, you have everything. I said, we do, we have everything. Tell me what you need, and we got it. And if we don't have it, I bet you I'll find somebody that has it, and I'll bet you it's gonna meet that need, because if it's not, I'll create it. Because I was done with where we were at. And I was done with seeing us suffer, because suicide and addiction is hitting every single one of our families. Yeah, I'm treating mental health in that group. Trauma, somebody says it's not 100% trauma for addictions. That's not true. I see it all the time. I've seen 100%. I'm waiting for that one person to say, nope, I have no trauma. Okay. It's an open group to all of our community. But I'm not just treating one part, right? Or one person. We have a family night. It's Friday in the evenings. Bring in your family. We're gonna help your family understand, help them to help you. Bigger picture, education, understanding. Bienvenido program, when I came out here in 1995, it was an idea that was far, like, it was out there, right? And then it started to come into the communities, and we started to hear it. People started to learn. Well, we need prevention, we need education. Without that, we're gonna see the next 3 generations in a not great place. So we need to do what we have to do now to prevent 3 generations later. And that's what we're doing now. But years ago, we wouldn't have seen this. Never. I got to stand in line years ago when my kids were little, for your health fair. Standing there for hours, first came out here. We didn't have the community, the Latin community to go to. we used to have to go to Chicago to get our tortillas and our chile. Like, it was a big deal to do that. And look where we're at now. But we have to bring in everybody, the police, the hospitals. Everybody matters. And so when we come together, we do great things. But we also create a safe community and a safe place for our families, our homes, everybody that comes through. And we're prepared for anything when we have that. People are talking about big numbers coming through. I'm like, bring them on. We could take it. We'll create it. We'll make it happen. How many numbers came through that health fair, right? And it happened in an orderly fashion. But the culture and the language is what we didn't have. And so now we have it, and we're growing from that. But we have to continue to support each other and come together, not just in an event like this, but all the time. All of our voices, because we're building on people's strengths and empowering them. And that takes all of us to do that. And so this brings me great hope, along with what I do by healing and giving hope to others. That's how we create safety. And so thank you for having an interpreter. Goodness, I'm not doing it this time. It's just amazing to see this growth so many years later. I love it. Thank you all for everything you do and for being here, taking the time to listen and to care. I mean, care and compassion, right? That's what we do. Thank you.
I'm just taking a second here. I was deeply inspired by Jona's words. I resonate so much with what everyone who has spoken up here has shared, whether it's through research, through data, to be able to communicate what has been described as a crisis, but also as a situation that has always been very present and ongoing. And I think I will reiterate that, a few years back, I grew up here. We immigrated here when I was 3 years old. I don't think that the conversations like we have today, explicitly like we're having at this space, could have ever been dreamt of, right? And so I just want to take a second to digest what Jona has shared, express the hope and the reality of acknowledging that we are not walking alone, that we're not doing grassroots work alone. I don't think we ever have, but now that we're speaking with each other, getting to see each other, I think that's the beauty in all of that. One of the things that I was mentioned, I don't know if it was Liliana or another speaker, but they spoke about individualism and collectivism. And that clash of cultures as well between those who have been born here in the U.S. or have never needed to immigrate, whether to a different state or to a whole different country or continent. I think right now is one of the greatest times to be alive as well, because we're realizing what it's looking like for the future, right? What it means for these different generations and cultures coming together, specifically in the Midwest, to see what we can do creatively and what we can do boldly for the sake of our future, right? That it's no longer just immigrants arriving. Yes, there's crises around the world that are occurring for immigrants to arrive to the United States specifically, but it's also the fact that there are 30 plus years of experienced immigrants, right, that are here in the U.S., especially in our region, that can help answer questions, right? That can be a part of the solutions. That will be the voice, right? That it's no longer the token folks like Saulo mentioned as well. So I think it's that great opportunity to be alive, and I'm really excited to be here, right, and to be able to do that. And also acknowledging that as I look around the room, I see so many generations as well. I see Tere and Carla, like we grew up like in high school. Like we were at that time in 2011, we were in despair because growing up undocumented or in the undocumented community, we were thinking, wow, what's the future gonna hold for us? But we were able to find community with each other as young people, and seeing us as professionals today is absolutely amazing for me. So I just wanna have a round of applause for all those generations that are still here present. So, as mentioned, my name is Dara Márquez. I work at La Casa de Amistad. That is my day job, and my whole job is also to be a daughter and a sister. I grew up here in Elkhart, Indiana. We moved because of the push and pull factors back in the 90s, or starting in the early 90s with NAFTA and the open borders, and that really pushing many in my community in Apan into not having as many resources as necessary to have a dignified life. So we immigrated to Elkhart because of the manufacturing pool that's still happening today with the RV industry. And so most of my family, I grew up with most of my family members working at the RV industry. Many still very entrepreneur-minded, which I think is also very common amongst our immigrant communities. So having grown up here in Elkhart, I was able to witness a lot of what many of us have seen, right, that have also grown up here in Elkhart. Being a part of the region, I also was aware of La Casa de Amistad. La Casa de Amistad turned 50 years old last year. It was founded in 1953 or 63, and it was primarily started as a safe space for migrant youth. At that time, many migrant families were coming in from Texas, from Florida, from different parts of the country to work here in the region. I think naturally many were saying, it's a pretty tiring process, so I want to settle down, I want to stick around here. South Bend isn't too bad. And they started to settle down. And so what happens in many communities as you're settling down, you're wanting to create those safe spaces, right? We've talked a lot about safety. So La Casa Amistad started off as that safe system and support group for migrant youth and their families. And throughout the last 50 years, the signs of our times have really pushed us to change in the way that we provide a service, in the way that we advocate, and in the way that we also think about our futures. So recently we moved to a new building. We used to be on the west side of South Bend in an 8,000 square foot former Polish department store. And we moved June of 2021 to a new building, which is 5 times larger. It's about 40,000 square feet. And we're now on the south side of South Bend, right off of the bypass. And so we grew physically 5 times, which also meant that we needed to grow with our staff. We have 15 bilingual staff members, as well as 5 other contract folks. And additionally, we also changed in the fact that our impact was much larger. That 5 times growth was also parallel to the 5 times growth in the service, in the folks that we were able to see in a year's worth of time. So the 2022 data and the 2023 data show the average of us serving at least 3,500 people a month, which was also a 5 times growth. And it's primarily because of our regional location. It's still in St. Joe County, but we do see at least a quarter of folks coming in from Elkhart County, from Marshall County, Kosciuszko, and St. Joe. So in general, the regional impact has continued to be visible as we've been present in that location. We have 3 primary services and programming that we have as an umbrella. One of the first is immigration services. We have an immigration legal clinic with 2 Department of Justice representatives, as well as legal assistants. And our DOJ representatives provide that process of being able to do family-based cases. So immigrants that are needing to renew their DACA or deferred action for childhood arrivals, their TPS or temporary protection status, if they need to discuss their eligibility on a U visa or a VAWA, as well as general questions for eligibility for citizenship. So folks that want to wonder if their children turning 21 would make them eligible, for example, to become a citizen, amongst other type of cases. So our immigration legal clinic is able to serve in that way. Most recently, we do see a higher need in being able to address the large number of asylum seekers that are arriving, and unfortunately in our region, and also thinking about it statewide, the politics and the policies behind being able to support the immigration services for these families is not present as it may be in other states like Illinois. But we're trying to do our best that we can in partnership with the NIJC, the National Immigrant Justice Center in Goshen, as well as Catholic Charities, amongst other partners, to be able to think about the legal needs, the most immediate legal needs that asylum seekers are having at this time. Our second program is within youth development, which is where I'll focus here shortly. And our third will be social services, and that's something that we've continued to develop, especially in our new space. Our social services range from different ends of the spectrum, from a simplest question like, I received this in the mail, I don't know what it says due to a language barrier, or simply because we don't understand how the system works, right? How to pay our bill at the hospital, or how to pay, whatever it is. Within also the other end of the spectrum could be a crisis. We've had several cases throughout the last 5 months where women arrive with their children due to a domestic abuse situation. And so we've been able to develop that partnership, for example, with the YWCA in both Elkhart and South Bend, to be able to respond within that important window for the families. And so we've been that safe space for those families to arrive, and for us to be able to address that in a manner that is appropriate and dignified for the families. So we were able to support in social service within those ranges. The third point that we were asked to address as to what we see as important to be able to address as service providers through the perspective of La Casa de Amistad, which is a bilingual social service provider, but also a bilingual space, is really within the health area, as well as our youth development. Within our health and the social services, we do have community health workers in partnership with partners that have community health workers. And I often emphasize, and I think that Jona spoke about that grassroots work, the being the transportation, the translator, the interpreter, just the therapist, right? Sometimes being the listener. Our community health workers across our region have really been the game changers from the perspective of the work that we do at La Casa, because they are the one-on-one folks. But it also goes to emphasize the importance of that trust and that safety that community feels. For example, just our community health workers alone were able to see 241 individuals and their families. So 241 families, and we're able to do a social needs assessment for them. And the 94% of the folks that they served were Hispanic, given the audience that we serve at La Casa. About 86% were attended to meet our community health workers naturally to speak about their health, but their two main questions were pertaining to insurance or food. So food security has really been something that we saw be a high need this past year. And one thing that I wanted to point out, and to my point of the importance, is that mental health really scored a 3% within the questions that folks that our community health workers saw. And the fact that it's that low, and the fact that we just saw the data that it is a crisis, goes to reiterate what Dr. Alegria said about being able to bring up mental health literacy and making it something that is normalized in our conversations throughout our services, right? For example, being able to equip folks like our community health workers or our social service coordinators at La Casa de Amistad to know how to introduce that in a manner that helps that conversation to continue. as well as continuing to support our partners that do that tangible work, especially those that work in crisis for substance abuse, for domestic abuse, etc. Being able to continue to stand behind them and support that work. The second point in regards to importance is continuing to support the youth development work. I think that all of us here in this room have understood that, and that's why we're here today, or we're concerned about the lack of resources there may be. And so just continuing to think about in that way and consulting partners and bringing it back to that conversation of collectivism. I think that's the switch when we talk about cultural competence. It could be that we are culturally competent as service providers, but it's also the fact of being able to be bold in collectivism, because that's not our nature or our culture within the United States in general. But thinking about as a coalition, we're all really under one system that is in a way still oppressing those resources or oppressing those conversations that need to be had, to know that we're all in this together, to expect the best of each other, right, no matter what, and to think of that youth that really need it. At La Casa de Amistad, we have been able to receive funding specifically for our youth development, so we will be opening positions for our community members to join us in LCSW to have in-house therapy and support for our youth program that serves over 250 students a year, as well as being able to have more coordinators that are there to develop our youth in after-school programming as well as summer, and our parent engagement, which, again, to parallel the research presentation, that it's very, very much necessary for the parents to be engaged in these conversations. So thank you for your time, and I'll wait for questions. Thank you.
So now we will have questions. Again, let's just thank them, give them a round of applause real quickly for the great work that they're doing in the community. If you would like to ask questions, I just ask that you talk loud enough that I can hear. I'll repeat the question in the microphone just for our virtual listeners, and then they will respond. So go ahead, anyone? Questions?
If you were gonna make a coalition, it sounds like there's a lot of people here that could make a coalition, especially for youth development and mental health. How would you do it? What would you bring to coordinate across the groups here? What would it take to coordinate? Sounds like Casa de Amistad has a big space. So space is not gonna be a problem.
Right.
So what can we do?
So the question was, if you were to make a coalition, who would we do? What would you do to create this? Whoever wants to respond.
I would say find the person with the greatest strengths in organization first. Because if you have that, it's a lot easier to start something.
I agree. Definitely somebody who can take the lead to organize and to kind of pull individuals together. But you also want to make sure that within the coalition you have members representing different sections of need, making sure that mental health is the focus point, but also seeing individuals that can help in the schools, individuals that can help with the medical policy makers. We really need them on the table. Alongside individuals who are those meeting the families, direct support. So you want both ends of the spectrum, policymakers, researchers, but you also want the direct support so that you can be well-rounded. A coalition also needs to be able to go and educate different organizations. I do believe that there is the heart here in Elkhart for change. And I think we all can agree that, Elkhart has a philanthropical community that is like none other. So I think utilizing that and making sure that we have a great organizer and that we have the key players would be very important.
Just to mention, I think getting to know one another first. We have not done that enough of that. Getting to know cross-generationally as well, to think about what the solution would be or the process in a multi-generational format. And then I think the third one is being able to learn about the system together versus individually, because I think we all perceive the system of, I think at the end of the day, it's really politics. Being able to understand that together and have those conversations that we have not had before.
What other questions? I have one. Oh, go ahead. Go.
My question is for Dara. I'm curious to know if, since that Casa expanded, have you developed any partnerships or networking, conversations, or activities with children school corporations in the last few years that are closer to support youth in the school and even youth?
So this question's for Dara, talking about since they've expanded their building and their community, what kind of partnerships or networking have they done? Go ahead.
So a full disclaimer, I just recently turned a year at La Casa Amistad, but I also came in while we were learning to walk in this new building. I think the 50 years longevity of the organization has been able to just be able to have that conversation in a deeper manner, especially now that times have always been changing, right? More specifically, in the most recent year, we were looking towards being able to be speaking with the South Bend School Corporation for the after-school program students that are in our programs, being able to understand what resources are in their school, and also being able to communicate what we observe within the student population. We have students that represent 40 different schools in the South Bend schools, whether it's private or public. So that's one way. The other is we're going to be, we are organizing a showcase for the first time to be able to display school options for our community that highlights the differences of the type of schools, charter, private, public. And our main speaker will be the South Bend School Corporation, given naturally its size, but also its impact in the community. And so being able to emphasize that and hold each other accountable around that. So those are some tangible examples. I don't know if that answers the question. Mm-hmm.
Awesome. Go ahead, Lisa.
I have a question for all three of you. One of the points that Dr. Raegan made was about the important role of community health workers or peers in the mental health realm. So we clearly do not have enough bilingual therapists to do all the work. So I'm just curious what your reaction is about the idea of community health workers and peers doing some of the mental health support. And is that something that you see already happening? And just would love to hear your reaction to that.
To repeat the question is, what are some reactions that you have with working with different therapists, community partners, doing some of the mental health work in our community?
As a community health worker, I encourage it, but I also want to be able to kind of warn others. Do it if you have been given some sort of training. Be able to, if you're comfortable with that, I encourage it because our people really need it. In my role, I do some. I don't do crisis mental health because I'm just not trained in that, and so I wouldn't want to, give somebody even more to deal with. But it is key because we are the individuals that are first seeing these our community partners coming in. We build that trust with them, and so they are able to open up more to us than, say, a provider who just comes in and gives you a paper and says, well, here it is, let me know how you're feeling, and then they might not even go through that paperwork. So I encourage it if you have the proper training, if you feel comfortable enough to do that, but then also know your resources and be able to direct them to an actual mental health provider who has been given the education to do that. It is important for us as community health workers to know the signs, to be able to have those conversations, but I believe that it is more of us connecting them to the proper providers.
What we've experienced as a bilingual therapist is you take a crisis and you don't have somebody to hand it off to. So a lot of education, going to the younger generations, talking to them, empowering them to take on these roles, to get back to school, to do what they can, even at a bachelor's level. Maple City Healthcare Center took on several bachelor's level social workers, and they are on the job in crisis roles, doing what we do, safety planning, walking with them, resources. We're not waiting until you get to a master's level because we don't have time. We have to do it now. And so my handoff is often to that, but talking to the schools, we saw Goshen College step up with the program that they started. Bachelor's levels are going into that for the masters. But the empowering of them and helping them to understand the huge need, yes, all these other parts are important, but if you really want to make a difference and save the world, you want to go into social work. And I talk to people all the time, recruiting all the time. Rafaela, go to school. All the time, because you don't have it. You can't say, okay, I'm going to have you talk to this person. We don't have each other. And what we carry is very heavy already, so we try to do what we can. But when I talk to people about suicide, and I say, this is what I want you to pay attention to, because it can be somebody you're sitting right next to. It can be your neighbor. It can be anybody. How many times do we see it all the time, and we pretend like we don't see it? Ask the question. Don't be afraid. Are you having suicidal thoughts? If they are, they're going to break down right in front of you, and you walk through it with them. What do you need? Listen. But the magic question is not harmful, because if they are having it, they're going to tell you. Or they're going to break down and you see it. So we can't wait. You have to pay attention to each other, to the children, all the time. None of us can get away from seeing it impact our churches, our families, our homes, the communities, the schools. So turn to each other and talk about it openly. And talk to the children in the schools about social work, what that means, all the opportunities that come with it.
Yes, I reiterate what they're sharing. I do believe that we don't have time. Being able to empower folks to be trained or obtain education among social work, or being able to be present in that way. It is a great challenge for us at La Casa de Amistad with our social service coordinators. They're primarily folks that are recent grads in things like psychology or social work, or some that are only high school educated, but they're there because they want to serve, and they're doing so creatively. So it is a challenge, right? And being able to address, especially when folks arrive with a crisis, how do you de-escalate? How are you a good listener? How do you, be able to respond the way that Jona shared? So it is a constant question we have. I don't know the full answer aside from help, but just reiterating what both have shared as well.
Go ahead back there.
Thanks. First, just want to say a huge thank you to the three of you. You're articulate and inspiring leaders in our community, and we're just really grateful to have folks like you in the community. So thank you. Secondly, we heard from Saulo this morning about sort of that experience of that first generation immigrant. We heard in Dr. Alegria's presentation about folks who are the children of those immigrants, and we have folks who are the next generation and the next generation in our community. So could you talk briefly about what are those sort of big picture differences you're seeing in the mental health needs of those different generations of youth in our community, folks who are newly arrived or are the second or third generation, and how we should respond differently to them?
I see this all the time. And they say, Jona, people don't understand me, the adolescents. And I said, I do. And they say, they tell us about 2 cultures, 2 languages. And I said, I get it. It's not 2 cultures, 2 languages. It's our culture, our language. And it feels really nice to speak Spanglish, if that's what you want to call it. It feels so good and safe. And we don't come from 2 cultures. We don't fit in those cultures. We have our own. We have our art. We have our history. We have it. And each generation, each next generation creates that again and again, but we have to give them what they need and show them how it has been created in other parts of the country already. They come here to the Midwest and it's like, okay, this is new. No, it's not new. It's been happening for thousands of years. It's new to here. And I experienced it myself. But normalizing it and helping them to understand that these are their new strengths and they can carry all of this in a different way, their own way, and helping them to find that, but bringing them together and helping them to guide this new role that they're creating. But just being there to support them through that, but bringing them together is what makes the biggest difference, because peer support is beyond what I can give. And you bring them together in big rooms and you have them share that, they find their way. Because when we say self-care and we say find an activity to keep yourself out of trouble, they don't even know what that means. They will tell you, all I know is you work hard, you clean the house, you cook, these are the things you do. What do you mean activity? What do you mean self-care doesn't even exist in my brain? And so we keep using those words, and so we have to get away from using that and teach activities, have people out there. I mean, history taught us, different types of pools came together and said, let's teach you how to do something, right? When we teach these things, now they have something to do, and guess what happens? They're no longer getting in trouble. But we can't tell them, go and do this. And they tell me that all the time. I have the adults now in the group, and they say, people told me that all the time. But I don't know what that means.
A couple more questions, go ahead.
Thanks to each of you for sharing. I do want to say that, Mayra, you are doing a great job of pulling together a coalition of people, and I hope that we can grow that with your leadership, because you're amazing at doing that. We've talked a lot about education for Hispanic folks, for immigrants, about what it means to live in the Midwest, in the culture in Indiana. I am wondering, from the 3 of you as Latinas, what do I need to know as a white woman, a middle-aged white woman, about how to be more culturally competent in relating to the Hispanic community? So I think that there is an effort to teach acculturation to Hispanic folks living in the community, but what do you need to teach us about what it means for you to feel safe here?
It's a deep question. It's a great question. From my own, personal background, I came here as an 11-year-old with my dad, immigrated, did everything that, if you will, the traditional way of how most people get here through the border and everything. And so there wasn't a group like Liliana's Bienvenidos when I first arrived. It was just a good luck kid. Nobody really taught me the rules on what school, was supposed to be like. There was no community behind it. I think one of the things that is very important for providers to understand is that the Hispanic community is very resilient, and immigrants even more so. We don't like to ask for help that often. So oftentimes the people who are coming to you are already crossing that hard mindset of, okay, I need help, I'm going to go ask it. So maybe having an understanding that even them coming to you already is them becoming vulnerable, showing their vulnerability. Understanding maybe some of the struggles that they face getting here. Maybe doing some research on what it means for maybe a Venezuelan to get here. Maybe somebody from Argentina to get here. What are the different pathways and how that affected them getting here. Also just, learning that older immigrants are a little bit more closed off, not because of a not wanting to learn about mental health, but just because of that stigma of, oh, soy loca, you're crazy, it's just, but also understanding that there is this perception for them that is, it's just not normal for them to talk about it. And then also knowing that medication, when it comes to our population, there's also some stigma with that. So there's stigma about talking to mental health providers, and there's also stigma about getting medication for it. Just knowing those little intricacies would help a long way. Knowing that we value family, and we will do anything for our family, even if it means getting help for ourselves. So maybe coming at them with that lens of you're helping your family by helping yourself would be very helpful.
So often most of the culture will identify as the man has the decision, and people are not allowed in the home unless the man has agreed that you could come in the home. And so oftentimes people go out into the homes, into the communities, and want to go to that door, but then they don't realize that they're creating some violence in that home by doing that. And so I say be very careful, ask for that permission if you are a man coming into that home. But the thing that we often say is you should trust the police. Well, if you're coming from a country where you don't, we have to teach that. What does that mean and why? You should stand for the Pledge of Allegiance. Well, we have to teach that. That's not something that you're just grown up to know. It's not a disrespect. It's because there's no knowledge of what that means. And so explaining things and not saying you should understand this. Well, I have to break it down sometimes and go back and say, okay, at what level would this make sense to you? But the trust and seeking to understand and not asking, why did you do that? Seeking to understand the why, right? Because if you have somebody coming to you, a child, and their bedroom is a closet, they had nothing to eat this morning, they don't feel good because they don't have a doctor, so they're sick, sinuses, and they come in and then the teacher scolds them, now they feel worthless. And so saying, tell me what I can do for you, what is going on? But really listen, but not just with your ears, with your eyes, because our children speak with behaviors, not with words. And listen for what you can do without giving the shoulds and the demands. And then teach them what it means to go into these paths of life. And little things like what it means to budget, right? But not thinking people, this is the way we all are, because we assume a lot. But when we take away the assumptions and then seek to understand their role, we practice curanderismo, and it's a big, huge thing. Traditional medicine, we go back to our tatarabuelas, it's like forever. And when I started understanding it's the act of healing, well, that's what I do. But then I had people say, well, that's like a bad word. That's really bad. You don't do that. And I said, okay, well, I went to the University of New Mexico, took classes to understand where that, the research comes from, to understand how to relay it to people in a different way. Because I could tell you my grandmother did this, but what does that mean? So when somebody comes to school with something very strange or odd that looks to you, you can ask, maybe, what does that mean to you? But we do limpiezas, we do things that are traditional healing, but it's just normal to us. But to explain to somebody else, they may not get it, right? But the education on the word crazy, I said, let's take away the names, right? Let's talk about symptoms. Let's talk about what that means. And people often will understand that.
Awesome. Well, we are having to wrap up, unfortunately. Just again, want to thank them for their knowledge, their time, and just the work that they do in the community. So let's give them a round of applause. So again, make sure that you fill out the survey on those green QR codes on the table. Now we will be going to lunch, which is just be out here, this door to the right, and then we will come back for at 12:30 for the next panel. Don't forget to get your badge. To get lunch, okay. Wear your badge to lunch, I'm sorry.